Give me a second. Okay,
we are recording now.
Sure,
okay.
No worries.
Okay, we're recording. We're good. Just wanted to let everybody know we're recording this session for learning purposes and to showcase our knowledge on the web as well. Thank you.
Yeah, we will be sharing the recording later in the social media. So with that, Sarika, go ahead and let's have introduction from everybody.
So we'll just take a minute to go around the room, just asking ourselves, asking you what brings you here, what you'd like to get from this webinar. We want to make sure that you get the best of your time that you come here. So I'll just go in no particular order. I'm just going to go by alphabetical order. Maybe Alfisha. Okay. She's on. You're on mute, Alfisha. I'll come back to you. Let me know when you're ready. Ankita Mishra. Can you unmute yourself?
Hello, can you hear me?
Yes. Hi, Ankita.
Hello.
Yes, I can hear you.
So Ankita, just the name and the company you work for and what brings you here. 15 seconds.
Yeah, I'm Ankita and I'm from Optizm Global and I work in the talent acquisition team. And I came here just to learn more about the AI platform and the basics I can get knowledge from this session.
Excellent. Let's go to Chandru Sharaf. Unmute yourself, Chandru.
I would like to interrupt. Hi, I'm here just to gain some insight into AI as it relates to healthcare. I'm a former healthcare executive, so just here out of curiosity and to learn a little from you guys. Thank you.
Yeah, Anshuman, go ahead.
Yeah, since the webinar is only for 30 minutes and we have 20 plus participants, I think even with 30 seconds, it will be 15 minutes gone. So I think we should start and introduce the participants with their question.
So everybody has to ask a question. That's fine. That sounds good, Anshuman. It's a good for engagement. Anybody, let's just give 30 more seconds. Anybody wants to introduce themselves, unmute and go ahead. We want to have engaging webinar. So with that, we'll start, okay?
Sure.
So if nobody has anything specific, no worries. You will get a chance to speak later. And then at the end, we will have a raffle of $25 gift card. And also you get entered into the raffle for our monthly raffle, right? So with that, I'm going to share my screen. Agenda for today. Those who are just trying to understand what is AI, I'm going to cover that. We're going to look into the use case of AI in healthcare and a quick question and answer. And we talked about the survey. So Sarika will put a link on the survey link. So you will get to enter that, your feedback and enter into the raffle. So very basic. Let's cover what is AI, right? So artificial intelligence is the capability of machine to imitate intelligent human behavior. In the past, machines were not able to have this much intelligence, like cognitive abilities, and it was not considered that intelligent. But now with AI, they are able to imitate human behavior. Little bit more into this. Machine analyze images, so they can make sense of images. They can comprehend a speech, so they will not store the data, but also understand what is being said. Interact in the natural ways, meaning it will respond to you as if it's a person, like Siri and Alexa, Cortana. And then with the data, it's gonna predict certain outcomes. So that is, in short, the summary of AI. Let's take an example. What used to happen in the past is we used to learn technology, and then we used to use technology for our advantage, and technology would behave in certain manner as you have programmed or as it's supposed to behave. But with the advancement, things are changing, because now the machines are able to imitate behavior, like it can listen and sense certain condition, it can observe, it can anticipate, and it can look at the data to schedule and coordinate things, right? So for example, I'm wearing Apple Watch. By 10 o'clock, 10:30, if I have not done enough exercise or not burned enough calorie, it says, I'm anticipating, the technology is anticipating certain calorie burn. Manish, you are being lazy. Can you go and run, right? So that is a good example. Coordination is another one. I can ask Cortana to schedule a 1 hour focus block in my calendar, and it will find a time and block it, or schedule a meeting with Anshuman, that kind of thing. So that covers pretty much what is AI. So why AI? Let's look at, yes, there is a lot of talk of AI, but why do you need AI? First is, with the rise of smartphone and all the cloud and smart devices, the experience for customer has gone up. Everything is right now thing, and every comparison is whatever you have on your smartphone, right? Like on the home page, you see you have the application like um, LinkedIn, Google, YouTube, Airbnb, and Uber. So the experience is very high for individuals in their hand. So they expect similar experience with you or your business. So you have to raise the bar, and how you're going to do it with more human power, or you can use AI for that. Second is the availability, same thing. People want everything right now. And that is in general for technology, but that's where you use AI specifically to provide more instant answer, maybe with a chatbot, right? Personalization is same thing. It's all about data. Can I have enough knowledge about your behavior, your related likings, so I can personalize the experience, and then you're gonna stick, because people will switch the brand if they don't feel connected. So same thing is true for your business or any organization, if it is a even healthcare organization, right? So why there is a lot of talk of AI? It's capable now. With the rise of cloud, the power of cloud, and the availability of the data outside your organization, it is possible to have less error in speech recognition. I mean, example is the error rate has gone down all the way to 4%. I have accent, but with my accent also, Siri can understand me. People with having less accent can be doing much better. Same thing with the image recognition, Face ID, or using the face recognition to unlock phone is very common. Unlock PC using Windows Hello is very common. So this is available right now. You don't have to wait for technology to become more mature. Let's look at quick examples on of the benefits, right? So any application, software application does improve productivity, but to be specific, the biggest gain will come in terms of employee productivity, or the healthcare providers' productivity, doctors, nurses. And I have some numbers I'm going to show you. And then comes the automation for the processes, check-in process, or doing analysis or patient care, all that. Then coming the data. With the data, there will be new insight for that particular person. So the diagnostics can be very specific to me or the demographic I belong. So that is the other benefit. In general, these are the statistics. There has been studies, and 2.8 hours of individual employees are wasted on unproductive tasks. That results into 7 days a month. Really, 1/4 of year or more than that is actually unproductive. So can AI help on that? Yes, there are more data that whenever AI will come back into the practice, the labor productivity will be the biggest gain. So whenever you are thinking, remember, that's where the biggest impact will be. In the chart, you can see the major portion, 55%, is highlighting the gain in the labor productivity. There are more benefits and there are more numbers here, but I'll just highlight. You will have a better operating margin and higher net income with the use of AI. Let's look at some examples here. I'll take one example of a existing client. It's a startup, Serenitex. They wanted to use AI to detect certain medical condition, which could be migraine or a stroke. So what they did was they designed a headphone, which is capturing inaudible frequencies into the system. And that data was fed to the tablet. So this is like a simple system, which is just going through the charts and in the data and predicting certain, actually not even predicting, just showing you the results in the real time. When you infuse AI, that's where the real benefit is, that it can predict what is going to happen. And that could be the difference between life and death for people having cardiac arrest kind of situation. So this can be done at home once the technology comes out. It can be done at home or can be done in urgent care and can really impact lives. Yes, some more general example I'm going to show you is use of AI in precision medicine. We talked about having the demographic information. Personalization can result into more precision medicine. Machine learning will help into more studies and development of the medicine. I'm just highlighting some generic use case, but let's go specific, right? Which is Anshuman's use case. So Anshuman, I'm reading that AI is going to hire or fire us. Is that true?
I wish that was true. It is not true, but from a recruiter's perspective on AI and how AI is going to change the landscape of recruitment. But I would like to focus just on the healthcare industry today.
Okay.
So let me give you some data point over here, Manish. The average time to fill a physician role in a hospital system is about 14 months. So as the competition increases in the talent marketplace, this time to fill is expected to increase. Mm-hmm. And as you said that, more than a quarter in a year of our talent goes into mundane work. So if AI is in place, think of it, their productivity goes up by a quarter of that recruiter who is working on the physician role or multiple role in that hospital group. Another data point about nurses, it is projected that, in 10 years, 1 million nurses in the US will retire. So think of it, we are not producing enough nurses. So what will happen to the talent pool when it comes to, hiring nursing talent? How AI is going to change that is that, the data collected and reported by the AI recruiting software doesn't just improve the quality of the hire or the time of the recruitment, but it also eliminate the hiring biases from the system. So obviously AI is not there to magically resolve all the traditional challenges of hiring and recruitment, but it will help a lot. In today's world, I am looking at a couple of things where there is a great demand when it comes to AI-related medical image analysis, architecture and information management with big data connectivity and sensor data. So hospitals and large healthcare providers are looking for these type of resources right now. Another use case, which is very big, is in the electronic health record, natural language processing, clinical and drug discovery, and patient self-reporting, the two examples you already gave. Then, in operations and analysis also, and analytics, basically, the whole supply chain, AI can play a very big and a major role when it comes to automating majority of the function of supply chain, health operations, payment and revenue benchmarking. We have
Sure.
attendees in the audience who have great experience in that, like Vishnath and patient care. So obviously AI is going to be integrated in the whole recruitment ecosystem with a major emphasis on the healthcare industry. Thank you.
Yep, you highlighted a couple of good points regarding data and the natural language processing. In fact, I'm gonna take it us right there in next 5 minutes and cover some real example now. So we talked about the situation. Let's look at the example. So this is a COVID dashboard using the data. You can really drill down to that, and I'm gonna show you the live example also. But before that, let's just see the summary of scenarios, right? So you talked a lot of application, but for the attendees, if you want to categorize in 3 simple category, you should think in these three manners. Okay, first, think natural language processing, which is the chatbot, I would say. So any application or any process going, put bot in front of it to let it speak. In the past, you would go click on the mobile app or on the web, but bot can allow you to extend the conversation via text messaging and natural language. Second is making the app intelligent. So there are a lot of modules, like Anshuman said, image recognition and speech recognition. So those are the modules available from Microsoft and other cloud providers, and you put in front of the existing application and make the existing application AI based or intelligent. Then comes the data insights on the existing business process. Like Anshuman said, there is a delay in recruitment, or in the clinic, if there is a delay in certain process, maybe check-in or handoff to pharmacy for the medicine, that data can come from the existing business process. That will be coming through the data insight or the BI dashboard I was showing. Okay, so these are the 3 categories. If you can keep in the mind, you can direct the conversation and then reach out to expert to go deeper in these areas. I'll cover the example of bot, but before that, let's take the example of a dashboard, which is a live one, and I'll put this link, but pretty much right, like the data is there, and you guys all have been looking at the chart, so I don't have to explain, but this is the kind of example. But if you quickly look how it has been going on in the last couple of weeks, then you will see the data coming differently for California. Okay, it's not refreshing, come on. Okay, it refreshed, little slow. So you can see trends are downward, but if we had gone early in the March and April, it would be upwards, right? So that was one example. Let's also go and see one of the chatbot for the healthcare, right? So instead of going and filling the survey, I can start. Okay, come on. Okay, my arm hurts, it says. So this is demo bot from Microsoft, which I'm utilizing. No, I'm not 33, 45. Okay. Actually, I will say moderate pain. It's going.
Manish, can you read out the answers also while you demo? It's a little small on the screen, or you can zoom into your screen.
Sorry about that. I'm using the biggest screen, so it may be very small. Let me make it big. Thanks for highlighting, Sarika. Hold on, I'll make it big.
So we can't read the options. Okay, thank you.
No, that's a good point. That is a good point. Okay, is it okay now? Can we read now?
Yes.
Okay, so I said I'm in pain, it could not understand. So that's where, actually, this is a good example, right? Sometime we can talk AI, but AI has to be taught. So machine learning happens when you teach. So that data has to be fed. So this is where it doesn't have enough data, but it said, I said, my arm hurts. It started asking me, okay, so how old are you? 45, gender, male, when did it start hurting, how much it's hurting, moderate, when, 3 days back, where are you right now, staying the same, where, shoulder, that kind of thing. So this is an example that it can be conversational and it can be more personal, right? So this is where it can be personalized. Now it's looking for the data related to my age group and really making it personal. So I can keep going and it can get me to a state where I'll feel that, okay, I have some idea that I should not be worried, or I'm really worried kind of scenario, right? So that's what I wanted to highlight. Oh, okay, let's go back to our presentation. I need to switch my screen because it was other way around. So what's the time? Okay, so let's wrap up in 2 minutes. This is another example of a simple bot. How may I help you? For a healthcare provider, you can list all your services, what services you provide, birth control, STD, STI, STD, book appointments. So booking appointment can be automated. You can chat with the bot, all that kind of scenario. So this is one example of conversational AI. Let's look at some more example on other industry, but if you can see on the healthcare remote patient monitoring, which we just talked about, maybe, taking a picture of yourself and sending it to doctor, and then AI helping in the condition and your situation. Other business use case within different departments. So if you want to split by department, there are a lot of example. I'll just highlight few. Patient analysis. Are you having repeat patient? I mean, you don't want repeat patient, but repeat visits for healthy checkup is a good scenario. Customer service, we talked about bot. Operations, this is always a challenge for every healthcare to have right kind of service providers, healthcare service providers at right location. Always a forecasting issue. That can help with the AI, and then patient insight or even the doctor's insight will be the. So for this video, we're going to talk about insights. Okay. With that, I would want to see if there are any question. Otherwise, we'll try to wrap up now. Okay.
There is a question from Anil. Mm-hmm. How many data points and the size of Anil, do you want to ask your question to Manish right now? You can go ahead, unmute yourself, and please ask him.
Yeah, sure. I was just saying, for a healthcare SaaS platform, is there any data points, minimum data points and minimum data size we need to have an AI implemented? And are there any AI open source tools in Microsoft Azure?
Open source tools are there, absolutely, and but when you are having the engine, right? So okay, let me start sharing. So whenever you are having the engine running, you will have to be on one of the platform. So that will involve payment, Anil. So initial testing and all is fine, but once you have running system, that will cost money. So there are very less AI system which are free. All the cost is on the recurring payment. Does that answer your question?
That's one. And are there any minimum data points or size of the data minimum? Yes. We need to get the AI implemented?
Yeah, data point, you can get a lot of data point. I think one of the best part on that is you will get a lot of data point free, openly available on public, won't be personalized, right? And that's where you will have to do the customization, but data points, yes, you will find it. I mean, there is no direct answer that here is the data point, but you will be able to find in the web. Second question is Vivek. Yeah, I think again, the teaching or making the AI smart or making the machine learn is the biggest piece of the puzzle. Technology is fine. How you teach and how do you guide between the parameters is the biggest puzzle. So in order to make that system really smart, you need a lot of data. But the wider you go, more challenge for you to teach data. If you have a database, you can cleanly teach. If you go wide in the big data world, it's more challenging for you to make sense of that big data. So that's where the challenge comes. What about on or separately, what about AI on blockchain is a better way? I'm not a blockchain expert, so I would say my partner Dave is much better on that. So we'll get back to you with that answer.
We have somebody called Waxter.
Yeah, Vivek,
Waxter?
right? No,
Vivek.
Waxter. Oh, Vivek. Okay, Waxter asked. I addressed that question.
Okay.
Sure. Let's go ahead and wrap up our slides so we can go with the raffle. Quickly, these are the services, right? All latest technology, collaboration, AI, integration, and SQL and SharePoint support. Anshuman, go ahead.
Yeah, this is the company slide for my company, Optizm Global. So been in business since 2011. These are some of our clients where I do frequent placement services. So far in the last 8 years, have served 75 companies and have made more than 501 placements. We only do W2 type of placements. We are not a corp to corp H1B centric resource pool of talent. I can get those talent, but my business model is trying to find you a best talent who is out there for the requirement that you have. Our offerings are talent acquisition, executive search. If you are interested, I can send you the slide, but I think Sarika will be posting it on you. So let's start the raffle. Let's see who won the $25.
We'll be announcing the winner right now for the $25 gift card. So
no, but I see a Xbox.
That's a monthly raffle.
So this is monthly.
Okay.
This will be announced at the end of the month, but here is the link, which is, I think, in the chat, right, Sarika? It's in the chat now?
Yes, it is. It is. So we have another question from Vivek while we wait for the results.
Yes, so there is a link in the chat. Please go ahead and fill out that survey so that we can decide on the raffle right away before you guys leave. And here is the question. So yeah, go ahead, Manish.
Okay, so the what I was saying was we will actually wait for everybody to fill and then just confirm if somebody is still filling, but then we'll announce the raffle. Meanwhile, I'll take the question. So the Mo on the Xbox, I also didn't know that, but Waxter, if you had to rank in terms of adopters of AI in the next 5 years, what sectors? Yes, the healthcare is a big one, manufacturing, and also the professional services. With the rise of the remote work, we will see more infusion of AI. The biggest department, I would say, is the direct to consumer. So whether it called retail website scenario or customer service scenario, across the industry, that is the fastest adoption. And this we are talking an AI which is easy to use, easy to understand for everybody. Every other AI is very complex database or the data related, and machine learning, which is made for, I would say, bigger companies and require more investment. So that will happen, but that will be all towards the process improvement, like we highlighted, right? So three ways.
But to add on that, Manish, I think medical image analysis is going to adapt AI very, very fast, because they think that, if they can analyze 1 million images, similar type of images, then, the treatment accuracy is much more higher. than just dependent upon the ability of one doctor looking at a film. So I think there is a big, and let me tell you, from the talent perspective, the biggest expense head in any company is the payroll. So if you can increase the efficiency by 25%, that means that you are going to reduce your talent pool by 25%. You have already seen that from a bank teller going to an ATM machine. So those kind of things, receptionist. Do you really need a receptionist in today's digital office space? So once that start happening, there is a tremendous saving that the company can build on. Each day you go to office, the HR is very particular that, I don't know what is going to happen. So all those risks goes away with the invent and advent of AI. So it will have a very deep penetration as well as very quick and fast adaptation.
Yes, agreed. And then another comment from Waxter is it needs a budget. So I wanted to highlight there is a ready-to-use AI, and that's where the adoption goes in. It's not in creating the AI, it's a use of AI. So whatever is available that you start using, like a bot or image recognition, library, speech recognition, which is already happening in Teams meeting, right? So our meeting, when it gets recorded, auto transcribe happens. So the adoption for the end user customers who are actually not creating AI will be to use ready-to-use AI, and that is across the industry. With that, let's see.
So we have a winner, Mo Rock.
Mo Rock, wow.
And winner for what? Xbox or
the
Amazon.
$25 Amazon gift card.
Okay,
so
Amazon.
Mo, can you type in your email so we can send you a gift card?
Whoa, Mo won? Damn,
Yeah,
Mo Rock.
lucky Mo.
My email.
Okay.
Yeah, Mo uses my email address.
Okay, that's good. Okay, so with
Thank
that,
you so much, everyone.
Thank you for joining.
I think that we are done. Exactly. So if nobody has any question, then we will be wrapping up. So let's just give 15 more seconds. Anybody, any final question? Otherwise, we'll wrap up.
I just want to thank you very much real quick, Manish. Excellent presentation. And it looks like, Sanjay, you look very different in this picture.
Oh, yes, Sarika. So today I'm Sanjay.
Okay.
Oh.
Great.
Okay.
Nice catch.
Yeah, exactly.
My video.
We just transformed him through AI today.
This is better. Okay.
One thing, this is
was AI.
Anil. Hey,
Good.
one thing in this is 30 minutes for this topic is not sufficient. This is a big topic.
Yeah.
And that is good to know, because we just wanted to have conversation starter, and if we have, actually we'll reach out via email and then maybe have another one. So good. Yeah. Thanks for showing the interest, and we'll have another one on this.
No, this was fantastic. Thank you so much, Manish, for taking time and really doing a community service and allowing people to be able to learn from your expertise. I was in here very briefly, but the way that you guys presented this is very condensed and straight to the meat and potatoes. So even though it was short, it was very educational. So thank you.
Yeah. And right, actually this is more level 100, and we have hands-on one day, what do you say, that AI workshop, but that is full detail one, like Waxter is saying. So that's totally makes sense. Okay, with that, thanks everyone. Thanks Anshuman for partnering with ThinkAI, and Sarika, thanks for
Thank you, Manish. Thank you, Anshuman.
Thank you so much. Appreciate
Thank you all.
Thanks everyone. Yes, bye.